Welcome back. Mental health is getting much more attention these days, with the pandemic bringing it even more to the forefront. Well, July is Minority Mental Health Awareness Month, and we're joined by Dr. Dawn Muhammad, a psychologist in Chicago with My Own Doctor. It's a Black telehealth network, and they talk about key issues for people of color. So let's talk about mental health in Black and brown communities, and Dr. Joins us this morning. Thank you so much for joining us. We really appreciate it. Dawn Muhammad again.
Thank you.
First of all, let's just talk about mental health in Black and brown communities and why it's so important to have an awareness month specifically for minorities.
So let's talk about that. In 2008, June was designated as the B.B. Moore Campbell Minority Mental Health Awareness Month. It is now the month of July, and it's known as the BIPOC Mental Health Awareness Month. And the need is twofold: to remove the stigma associated with mental health, and also to create awareness in communities of color about the need for mental health.
Okay, and so how does racism play a role in all of this?
Oh my goodness, racism is a public health crisis. So everyone has to deal with life stressors. When you are a person of a community of color, that is almost intensified. So everything is experienced in addition to possibly microaggressions. And this is one of the reasons why My Own Doctor is so important, because we are providing services to underrepresented communities, Black and brown, qualified professionals that recognize and live the shared experience of the constituents we serve.
And yet, are there some in the Black and brown communities who are reluctant to reach out for help for these issues?
You are absolutely on par. Let me give you two mores and two less. So Black people or BIPOC communities are less likely to seek out services and less likely to have access to services. They're also more likely to have lower quality services and more likely to terminate their treatment earlier. So again, My Own Doctor is combating this. We're removing or greatly reducing some of those barriers to access. And also, we are out in the community letting people know that we are here. We're here to support you in the ways in which you need.
We're hearing so much about mental health issues and so many people impacted. Would you consider it an epidemic at this point?
Definitely. And mental health doesn't discriminate. So like I said, we experience it. We experience as humans. We experience it as in the roles that we play: mothers, fathers, brothers, sisters, psychologists, social service workers. We all experience it. And because mental health is great that we have a month dedicated to it, but it happens all year round. So in that effort, we are launching, My Own Doctor is launching a free live webinar series to talk about coping skills and ways to keep your mental health in check all year round. We're launching it on September 15th. And if you go to MyOwnDoctor.com, you can download the app. You can be informed when our Heart and Health series starts.
Right. Now, that's great information. Thank you for sharing that. I also wanted to ask you about some of the communities. You know, I've interviewed many people in violent areas or, areas affected by violence in the city. I know it happens everywhere, but what impact does it have on children who see these kinds of crimes or know that they're in their community?
So these children, and I believe all of us, are kind of inundated with these negative narratives. And what's even more said, yes, violence exists, but right now the fastest growing population that are committing suicide are young Black males. So it's getting to that group. Those healthy coping skills have to be modeled and taught to our children. I don't know why, but a lot of people think that children cannot be stressed. They can. There have all kind of studies been done. Math anxiety, I know I still suffer from that. Children suffer from anxiety as well. So violence, they have to witness it. They have to process it. We all do. I'm sure we all heard about the tragedy in Texas, and we hear about these tragedies all the time. They need an outlet as well to talk to someone and to properly process these tragedies that they witness, because they do affect us all.
Right. In fact, I want to ask you about PTSD, because I've also interviewed people who have been touched so many times. My brother, my cousin, my neighbor, different people who have been impacted by these violent crimes. Is PTSD a problem?
PTSD is pervasive. It used to be called a shell shock. We thought that it only happened to those that served in branches of the military. We now know that that's not true. We now know that it's a brain injury. We now know that it can last a lifetime. It can last a lifetime. The symptoms include hypervigilance. You had a story earlier about the 4th of July. Those fireworks are a trigger for individuals who have been involved in gunshot or any kind of gun violence. So we play a game every July. I say this to my daughter, we play, is it a gunshot or a firework? And it's kind of triggering. It's very startling. So imagine, we see how it feels with animals. We see how animals react to that sound. Just imagine a person that has been diagnosed with PTSD has to relive that every 4th of July. Right. It can be tremendous. So it is pretty pervasive in the community. There are millions of people with it, and I think even in communities of color, even more so.
Right. And there's help. There's help available. So I want to thank you very much, Don Muhammad, for talking to us with My Own Doctor. Maybe that's an option for some of you out there to reach out for help if you're feeling some mental health issues. And thank you again. Appreciate your time.
Thank you, Roseanne. Have a great weekend.
You too.